Has someone you love started showing subtle but concerning changes over the past year? A lot of folks figure that death in old age hits all of a sudden, but the real deal is the body usually sends out these quiet warnings months, sometimes even a year, before life hits its final stretch. The issue is most people blow past these signs because they look small at first. It's only later, when you're looking back, that families realize the clues were right there all along. But by then, it's too late to get ready. Too late to make those last memories really count. In this video, we're going to chat about 5 key signs that often pop up a year before an elderly person passes away. Some of them might be stuff you've spotted, but shrugged off as just getting older. Others might be changes that seem minor, but actually signal the body's gradual wind down. Spotting these signs early gives you the chance to provide better care, cherish those meaningful moments, and most importantly, make sure your loved one's final stage of life is filled with comfort, dignity, and peace. Stick with us until the end, because these 5 signs can help you prep emotionally and practically for what's coming. When you get what's going on, you won't get caught off guard. You'll be able to make the most of the time you got left with those you love. Now let's dive in. Number 1, significant weight loss. One of the earliest and most telling signs that a person might be heading into the final year of their life is unintentional weight loss. At first, it might seem subtle. A belt that suddenly needs tightening, clothes that look looser, or an appetite that starts to fade. A bunch of families brush it off as just part of getting older. But the truth is, dropping weight without trying is rarely a good thing. It often means the body ain't absorbing nutrients efficiently anymore, muscle mass is decreasing, and essential systems are slowing down. Aging naturally leads to some loss of muscle, but when it happens too quick, it's a sign that something deeper is going on. The body might be struggling to digest food right, or the person might not be able to process protein effectively, leading to muscle wasting. This loss of strength don't just make moving around tougher, it ramps up the risk of falls, weakens the immune system, and leaves the person open to infections. Another reason for weight loss in the final year of life: appetite changes. A lot of elderly folks just don't feel hungry the way they used to. Their sense of taste fades, food don't seem enjoyable no more, and they might start skipping meals or eating way smaller portions. This ain't just a preference thing, it's a physiological shift. The body, sensing that it's starting to shut down, don't signal the brain to hunt for food as often. The result: less energy, less strength, and a gradual drop in overall health. And then there's the role of underlying medical conditions. Weight loss is a common symptom of chronic diseases like cancer, heart failure, or kidney disease, all of which can start ramping up long before more obvious symptoms show. Even stuff like depression or cognitive decline can lead to cutting back on eating, causing a downward spiral where the body ain't getting enough fuel to keep itself going. Some families try to fix it by pushing their loved ones to eat more, offering favorite foods or supplemented meals with protein drinks. But if the weight keeps dropping despite these efforts, it's key to recognize that the problem ain't just diet. It's the body gearing up for a deeper transition. At this point, forcing big meals might not help. Instead, focusing on comfort, easy-to-eat foods, and hydration can make a bigger difference in keeping quality of life up. If you spot significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay attention. This ain't just about how they look, it's about the body sending a message. And getting that message now can help you prep for the road ahead with clarity, compassion, and the ability to make every remaining moment meaningful. Number 2, extreme fatigue and weakness. One of the most noticeable changes in the year leading up to the end of life is a deep, persistent fatigue that don't go away with rest. It ain't just feeling a little tired after a long day. It's a profound exhaustion that makes even simple tasks feel overwhelming. Getting out of bed turns into a challenge. Walking across the room takes effort, and stuff that once felt routine, like cooking, dressing, or even holding a conversation, starts to feel too draining. This ain't just from aging. It's a sign that the body is conserving its remaining energy as organ function starts to slow. The body begins prioritizing what's most essential. The heart don't pump as efficiently, circulation weakens, and muscles don't get the same level of oxygen they once did. This is why a lot of elderly folks in their final months feel weak, unsteady, and unable to keep up the same level of activity they once enjoyed. Another key factor, metabolic slowdown. The body is built to produce and use energy, but as it preps for its final phase, that energy gets redirected. Instead of fueling movement, the body shifts toward preservation. This is why someone in decline might start sleeping more, needing longer naps during the day, and finding it harder to stay awake for long stretches. Some might even have sudden drops in energy where they seem fine one moment, but totally wiped out the next. But maybe the most heartbreaking part of this process is the emotional hit from fatigue. A lot of seniors who once took pride in their independence start feeling frustrated or even embarrassed that they can't do what they used to. They might pull back from conversations, avoid social stuff, or quit engaging in hobbies, not because they don't care, but because they just don't have the energy. This can kick off a cycle of isolation where they stop trying altogether, which only speeds up the decline. For families, watching a loved one go from active and engaged to exhausted and withdrawn can be tough. It's easy to think they're just being lazy or that they need to push through it, but the reality is forcing activity won't help. What matters most is understanding their limits, letting them rest when needed, and making their remaining days as comfy as possible. If you notice a loved one dealing with deep ongoing fatigue that ain't relieved by rest, take it as a sign that their body's going through a major transition. This is the time to cherish conversations, create moments of peace, and support them without expectations. Because in the end, what matters most ain't how much they can do. It's that they feel loved, understood, and at ease. Now let's move forward. Number 3. Increased cognitive confusion or withdrawal. As a person gets closer to the final stage of life, one of the most striking changes can show up in how they think, communicate, and interact with others. You might notice that someone who was once sharp and engaged starts to forget things more often, struggle to follow conversations, or seem disoriented in familiar places. They may repeat themselves, forget names, or lose track of time, even when they never had memory issues before. These subtle cognitive changes can kick in months or even a full year before death. This ain't just everyday forgetfulness. The brain, like any other organ, needs a steady flow of oxygen and nutrients to work right. But as circulation weakens and oxygen supply to the brain drops, cognitive function starts to slip. The person might get easily confused, have trouble making decisions, or struggle to recognize people and places they've known for years. In some cases, they might even have brief moments of lucidity, followed by sudden episodes of confusion, almost like their mind is fading in and out. Another common sign, emotional withdrawal. Someone nearing the end of life often loses interest in social interactions. You might see them speaking less, engaging less, or spending long periods just sitting in silence. It ain't that they don't care about their loved ones. It's that their brain don't process emotions and engagement the same way anymore. Conversations get tiring, loud environments feel overwhelming, and eventually, a lot of seniors retreat into their own world. You may also spot changes in mood and behavior. Some folks get more irritable, anxious, or easily frustrated. Others seem unusually calm, detached, or indifferent to things that once mattered to them. This ain't just a personality shift. It's often the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and the person might stop reacting to situations in the way they used to. For family members, this stage can be especially rough. Watching a loved one lose touch with reality or pull away emotionally can feel like losing them before they're actually gone. But it's key to remember this ain't something they can control. Instead of trying to drag them back into conversations, the best thing you can do is meet them where they are, speak gently, offer reassurance, and get that even if they don't always respond, they can still feel your presence. If a loved one is getting more forgetful, more confused, or less engaged, don't ignore it. These are often early signs that the body and mind are prepping for the final transition. This is a time to be patient, cherish quiet moments, and focus on creatine, an environment that feels safe, familiar, and peaceful. Because even when words fade, love and comfort can still be felt. Let's move on. Number 4. Frequent infections and slow healing. As the body starts to wind down, one of the clearest physical signs is a weakened immune system. You might notice that someone who rarely got sick before now seems to catch every cold, every flu, every small infection that's going around. What used to be minor illnesses now take way longer to bounce back from, and simple wounds like a small cut or bruise heal at a noticeably slower rate. These changes ain't random. They're signs that the body ain't able to defend or repair itself the way it once did. One of the biggest worries: repeated infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections get more common as the immune system weakens. A lot of families figure these are just one-off illnesses, but when they start happening frequently or take a long time to clear up, it's often a sign that the body is losing its fight-back ability. Even antibiotics, which once worked quick, might seem less effective. The person might need stronger meds, longer recovery periods, or multiple rounds of treatment for infections that once would have been minor. This happens because as circulation slows and organ function declines, the body just don't respond to treatment as well. Another overlooked issue: chronic wounds. If you see that small scratches, sores, or bruises ain't healing properly or keep reopening, it could mean circulation is compromised. Poor blood flow means oxygen and nutrients ain't reaching the skin and tissues efficiently, making healing much slower than usual. Pressure sores, especially for those who ain't as mobile, turn into a serious risk and can lead to dangerous infections if not handled carefully. What's even more concerning is that infections in the final year of life often don't look the way we expect. Instead of a high fever, an elderly person might just seem more tired than usual, more confused, or less interested in eating. In fact, for seniors, a sudden drop in mental alertness is often the first warning sign of an infection, even before other symptoms pop up. This is why spotting these changes early can make a difference in how much comfort and support they get in their final stage of life. For families, watching a loved one go through repeated infections can be frustrating and heartbreaking. It's tempting to push for aggressive treatments, hoping that one more round of antibiotics or one more hospital stay will fix the problem. But at a certain point, the focus often shifts from curing to comforting. Making sure they stay hydrated, keeping their skin clean and moisturized, and minimizing stress on the body can do more for their well-being than another round of meds that only drags out suffering. Now let's move forward. Number 5. Major changes in breathing or circulation. One of the most telling signs that the body is prepping for its final stage is a noticeable change in breathing patterns and circulation. You may notice that your loved one breathes more slowly or shallowly than before. At times, they might pause between breaths, or their breathing might get irregular, speeding up and then slowing down unexpectedly. Some people go through a gentle rhythmic breathing pattern called Cheyne-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. These changes can start subtly, but over time, they get more pronounced and more frequent. Another common sign: weaken circulation. You might see that their hands, feet, or even their nose and ears start feeling cold to the touch. The skin may look pale, bluish, or mottled, especially around the fingers and toes. This happens because the body is prioritizing blood flow to vital organs, cutting back on circulation to the extremities. It's a clear hint that the heart ain't pumping as strongly as before. Some folks also deal with more shortness of breath, even with minimal movement. Simply sitting up, speaking, or shifting positions might leave them feeling winded or out of breath. You may notice them breathing through their mouth more often, or they might suddenly need to stop and catch their breath while talking. If they were once able to walk across the room easy, but now struggle to do so, their lung function might be declining. In some cases, fluid buildup in the lungs can make breathing tougher. This can cause a persistent cough, gurgling sounds, or even a feeling of tightness in the chest. A lot of people figure it's just congestion from a cold, but in elderly folks nearing the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable, and they might prefer to sleep propped up on pillows or in a recliner to ease their breathing. For family members, seeing these changes can be scary. It's natural to want to help, to encourage them to take deeper breaths, or to worry that something urgent is happening. But in a lot of cases, this is just the body's natural way of slowing down. There might not always be a way to reverse these changes, but there are ways to make them more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease discomfort. In some cases, meds or oxygen therapy can provide relief, but the focus shifts toward comfort rather than trying to fix the issue. If you notice these signs, changes in breathing, cold hands and feet, or a bluish tint to the skin, pay attention. These are often indicators that the body is conserving energy and that circulation is slowing down. It's a time to be present, offer reassurance, and create a peaceful environment where they feel safe and at ease. In these final months or weeks, the most important thing you can give them ain't medical intervention. It's comfort, dignity, and the knowledge that they ain't alone. Final thoughts. As we wrap up this video, take a sec to think about what we've talked over. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often show up in the year leading up to an elderly person's passing. They might not all hit at once, and they might not always be obvious at first, but when you start noticing them, it's a sign that the body is prepping for its final transition. For a lot of families, these changes can be hard to swallow. It's natural to want to fight against them, to push a loved one to eat more, move more, or tough through exhaustion. But sometimes, the best thing we can do is listen to what their body's telling us. Instead of focusing on trying to reverse the inevitable, we can zero in on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs ain't about fearing death. It's about being ready for it. When you spot these changes early, you can offer better care, make important decisions ahead of time, and make sure your loved one's final months are filled with love and dignity. This is a time for cherishing moments, sharing stories, and letting them know they are valued and not alone. If you're noticing these signs in someone close to you, take a deep breath and remember, you ain't alone in this journey. A ton of families have walked this path before, and while it ain't ever easy, knowing what to expect can help you find strength, patience, and peace.